In this lecture, we're going to cover genital herpes, which is a common sexually transmitted disease caused by herpes simplex virus. There are two types of herpes simplex virus. The first type is herpes simplex virus type 1, commonly known as oral herpes, and it is spread through contact with saliva. Typically, this type affects the mouth or the face, causing cold sores, but it can also cause genital herpes. Herpes simplex virus type 2 is the second type that primarily causes genital herpes and will form our topic of discussion in this video. Individuals suffering from genital herpes develop sores and blisters that usually form on or inside the genital areas and the area surrounding it. In females, the most commonly affected areas are the vagina, vulva, labia, and cervix. In males, the penis and testicles are usually affected. This image here shows numerous small white bumps on the penis. Sometimes they can appear as red blisters, and when they rupture, they form very painful ulcers that may ooze fluid. In this image, there is an eruption of multiple red lesions, which are the blisters on the inner aspect of the thighs. The anus and buttocks can also be affected. Other sites that can be affected apart from the genital areas are the lips, mouth, tongue, cheeks, and roof of the mouth. One thing to keep in mind is that, even if a person does not show any symptoms of genital herpes like the blisters, the herpes virus can still be transmitted to another person. Both herpes simplex virus 1 and herpes simplex virus 2 infections are lifelong. A lot of people are affected by herpes globally. About 67% of people below the age of 50 years, which equates to 3.7 billion people, have HSV1. An estimated 491 million people aged 15 to 49 worldwide have herpes simplex virus 2 infection. Most oral and genital herpes infections are generally asymptomatic, which means having no signs or symptoms of the disease. Herpes infections are most contagious while symptoms are present, although they can still be transmitted to others when symptoms are absent. Infection with herpes simplex virus type 2 increases the risk of contracting and spreading HIV infection. Genital herpes can spread if you have multiple sexual partners and don't take protective measures into account, such as using condoms when engaging in sexual activity with an infected person. You can also get herpes from kissing someone who has open sores in the mouth. It can also be transmitted through direct contact with lesion fluid via skin-to-skin contact. And finally, via perinatal route, where a child gets herpes during birth from an infected mother. You can have the herpes virus for years without experiencing symptoms, making it difficult to determine when or from whom you contracted it, and you may unintentionally infect others. The average incubation period for an initial herpes infection is 4 days. The incubation period is the time between when a person contracts the virus and beginning to have symptoms of the disease. When present, symptoms of genital herpes include flu-like symptoms like headaches, fever, chills, tiredness, and muscle pains, itching or irritation in the genitalia, small red bumps or tiny white blisters or sores on the genital area that are painful when they break open, ulcers that form when blisters rupture, swollen lymph nodes, and dysuria, which is a painful urination. After a person acquires the infection, the virus moves from skin cells to nerve cells. In the nerve cells, it enters an initial period of replication, after which it becomes inactive, what is also known as the latent phase or latency. This inactive phase is characterized by a period where the patient does not show any symptoms of the disease. Reactivation of the infection can be induced by various stimuli like fever, trauma, immune suppression, emotional stress, UV exposure, and hormonal changes like in menstruation. The reactivated virus spreads distally from the ganglion to initiate new cutaneous and mucosal lesions. The diagnosis of genital herpes is based on proper history, physical examination, and the results of laboratory tests. Blood sample can be taken and examined for the presence of HSV antibodies in order to detect a previous herpes infection. A tissue sample or scrapings of the lesions can be collected for viral culture. And polymerase chain reaction test can also be done. Unfortunately, there is no cure for genital herpes, and that's why it is a lifelong disease. Recurrence of the infection is common, causing later outbreaks that are usually milder than the first outbreak. Antiviral drugs have been used, and they have the potential to prevent outbreaks. They can help to relieve symptoms and speed up their resolution as well. Antiviral medications that may be helpful for genital herpes include acyclovir and valacyclovir. If left untreated, genital herpes can result into complications. One of these complications is an increased risk of HIV infection and other sexually transmitted disease. It can also cause severe emotional stress for the patient and family as well. That will be all for this video. Thank you for watching. If you find this video helpful, please like the video, share it and subscribe to our channel.